This week, we're talking about communication skills in exercise oncology. The reason why I wanted to touch on this topic is because I don't really think that a lot of exercise science programs in the country are doing a good job preparing exercise science students to go work in a clinical setting. If you look at the nursing majors, they have clinicals and they have places where they go and observe nurses. And you see that model with other disciplines. I think for the most part, at least what I've seen with regards to different undergraduate exercise science programs, they're just not there. And I think that's traditionally because exercise science professionals have not really had a true seat at the table when it came to working in a clinical setting. With the rise of exercise oncology, I really believe that we are going to be more and more involved in the multidisciplinary clinical team. It's important that we learn how to conduct ourselves and speak as part of this team. We can hold our own in these conversations that we have. The webinar today, we're going to talk through talking with a medical team and what does that look like in terms of our communication. And then also communication with patients, because that is just as important. When you're talking to patients, you really want to try to earn their trust. If they trust you, they will want to work with you. They will listen to what you have to say. You will be able to educate them and empower them, but only if they trust you, only if they think you're credible. It's really important to build that trust and to build that credibility with the patients and with the medical team. What we're going to talk about today is understanding the exercise oncology communication landscape. So essentially what I was just saying in terms of communicating with the medical team, communicating with caregivers and patients, and what does that look like? And then we'll look at the impact of effective communications on adherence and outcomes to patients. When they trust you, when you're able to build and establish that credibility, how does that impact their adherence to the exercise program? And then in turn, how does that impact the outcomes in their cancer journey? Finally, we'll touch on communicating with the clinical team. What does that look like? Let's look at who makes up this multidisciplinary cancer care team. In the beginning of March, I did a webinar that was the exercise oncology team and who made up that team, the multidisciplinary people that were involved. For this particular conversation, I want to look at basically in terms of our communication with them. The first thing to start with are medical and radiation oncologists. Medical and radiation oncologists determine the chemotherapy, the immunotherapy, the radiation protocols that are going to directly impact the exercise timing and tolerance. You're going to want to know whenever you're working with someone who's in active cancer treatment, what is their chemo schedule? What is their radiation schedule? And you want to build the exercise program around that. Understanding these treatment schedules will help you know how to schedule exercise interventions. How can you time things so that patients have the ultimate energy to perform the exercise? Oncologists are going to have varying perspectives on exercise. For the most part, we really have seen an upswing in the enthusiasm with oncologists with regards to them embracing exercise for their patients and understanding that this is something that is of value for them. And so you're going to come across physicians that believe in what you do and support what you do. But then you may have other oncologists who are going to be more cautious and maybe they're not quite as aware of the literature that supports exercise during cancer recovery. I once worked with a physician, he was a radiation oncologist, and he was a skeptic in the exercise program. And I would share with him patient outcomes. And when he would look at that and he would say, yeah, you can't deny that exercise does help these individuals. But his bias or his concern was that our patients who self-select into an exercise program just quote unquote healthier than patients who don't. And that's why they have the better outcomes. And so I challenged him. I said, okay, let me challenge that idea. Give me a patient, refer a patient to me who you think we cannot help, and we'll try to help them. And so he sent a patient over to us. She was receiving radiation for, I believe it was colon cancer. So she was receiving pelvic wall radiation. And when someone receives radiation to their pelvic area, it does cause a lot of pain and a lot of limitations to their quality of life. And so this woman was in her 30s. She had, I think, 3 children. She was working before her cancer diagnosis and was in so much pain with her treatment that she wasn't able to work. She wasn't able to walk without the assistance of a wheelchair and a walker, and really had activity limiting side effects from her treatment. And he referred her to us and he said, if you can help her, then I'll buy into your program. And so it was risky. I was a little nervous about it, but I gave her at the time who was one of our best trainers, and he worked with her. And 12 weeks later, this woman was back at work. She was walking without the use of a walker. She had minimal pain. She could get in and out of her car and up and down off of chairs, like made a true difference in this individual's life. So much so that we wrote it up as a case study and had it published. And this physician now is such a huge advocate for our work. If you have a good relationship with an oncologist and you really believe in your program, you know what you're doing is evidence-based and safe and really impacting lives, I would challenge you not to shy away from having those difficult conversations. At the very least, give them the freedom to express their concerns or their reservations, and then have the knowledge to be able to back it up and to support the program and to potentially change their mind, but do so in a respectful way. That's the radiation and the medical oncologists. Next, we have surgeons. The surgical team is going to establish the post-operative restrictions that are going to directly influence your exercise parameters. And so you want to be aware of what those are. You need to have knowledge of the different procedures that the surgical team is performing, such as a mastectomy, a long resection, whatever that surgery might be. You want to have a baseline understanding of what that surgery is so that you can predict what to expect, what limitations or side effects, experiences that patient may have. And then that will help you to design appropriate movement modifications for the exercise program. Oftentimes, surgeons are going to focus on wound healing and immediate recovery. And so it's very important for you to be in communication with the surgical team to communicate how exercise can help support these priorities that they have. You want to show yourself as someone who's going to complement this team. You are here to support them and to help their patients have better outcomes. Anything that you can do to have knowledge of what these professionals are doing and to understand how exercise is going to impact these responses is going to be very important. Next, we have oncology nurses. Oncology nurses are frontline workers who have the most regular patient contact. They observe daily symptom fluctuations. They can provide critical insights into patient status. They build strong relationships with the patients. And it's going to be important for you as the exercise professional to build strong relationships with them. When I was first starting Mapletree back in 2011, it was the oncology nurses that I was able to bond with first. And they really embrace the idea of exercise. And they spend so much time with the patients, and getting them to talk about the importance of exercise is what encouraged a lot of patients to come to the exercise program and give it a try. And it was from there that we got patient testimonials, patient outcomes, and we could share that data with the medical team. And then they became believers in it as well. So oncology nurses are your friends. Try to do what you can to build a strong relationship with them and work with them to enhance communication flow and to have them be your ally in promoting exercise in the oncology care team. Next, we have physical therapists and occupational therapists. It's very important for you as the exercise professional to understand that sometimes there's going to be overlapping roles between your work and theirs. And so I believe having that clear communication, patient triage, and understanding when you need to refer a patient to physical therapy or to occupational therapy will really help everyone stay within their scope of practice, and then also prevent duplication of efforts and have that continuity of care that we really want to see. Next, we have registered dietitian. Exercise and nutrition have very important synergies with regards to cancer treatment. You can work with the registered dietitian team to coordinate the timing of the nutrition intake with the exercise sessions to help the patient to optimize their energy availability. You, as the exercise professional, should have at least a baseline understanding of dietary restrictions that can help explain fluctuations in performance, fluctuation in energy levels, and then use that to help guide your exercise recommendations. Finally, we have psychologists and we have social workers. These individuals are going to address psychological barriers that may impact exercise adherence. So you can work with these individuals to develop strategies for patients that may be struggling with motivation, or even people who have anxiety around physical activity. Most of the patients that we work with have never exercised before. And I once had a patient tell me that she was more afraid to come to Mapletree than she was to do her chemotherapy. And so understanding that is where some of these patients are coming from. That is their reality. And so how can you work with the social workers, with the psychologists to break down these psychological barriers and help find motivation strategies towards behavior change for these patients? So it's really important that you work together with this multidisciplinary team and have a solid understanding of what each professional's role are, what their priorities are, what their communication style is. And your job as the exercise professional is to position exercise as a complementary medical treatment. So, nothing that's going to compete against any of the other services, nothing that's going to replace any other professional on this team. We want to create a continuum of interdisciplinary care where each patient is being met individually with whatever their needs. So, moving on, let's talk about some communication challenges that are unique to exercise oncology. So, there are some distinct communication hurdles that we face in exercise oncology. One of them is bridging knowledge gaps. And so, it's something important to keep in mind that sometimes oncology professionals don't really have a background or received education on exercise science principles. Your responsibility then is going to be to provide education to the medical team about the benefits of exercise, as well as the structure of the program, the evidence base behind your program, and let them understand that there is true science behind what it is that we offer their patients. So it goes beyond just taking a walk or, oh, I just feel a little bit better after that exercise session. There's data to support the changes that happen in patients physiologically, psychologically, at the cellular level, that it's important that the medical team be aware of so that they can support what you do. Another thing is to translate exercise physiology concepts into meaningful outcomes. And this is going to really vary depending on the population you're working with. So if you're talking to a medical team, you want to try to focus on things that matter to them. So say things like enhanced treatment tolerance or reduced hospitalizations. Those are things that the medical team is going to care about. Like we as exercise physiologists care about improving VO2 max. The medical team may or may not understand the significance of something like that. And so focus on things that they really care about. When you're talking to patients, you want to address things that are going to be applicable to them. Hey, with this exercise program, you're going to have the ability to get up and down out of this chair or go up and down stairs easier. And that's going to mean more to them than saying things like, this will improve your function. They probably don't understand what that means. And so identifying improvements and talking about things in terms that are going to matter to the audience that you're talking to. Addressing misconceptions, you are going to run across these. And so be prepared to correct outdated advice. Mapletree began because a physician told my grandfather when he was battling cancer that he needed to rest and rest was best. And that's why I started my organization, was because I knew better. I knew that the research was there. I had done the research. I had seen how patients can benefit from an exercise program. And so the best way that you can do this is, again, sticking to the evidence base, taking opinions, taking emotion out, but presenting the research on the safety and the efficacy of exercise without at the same time of doing this, you don't want to appear to be dismissive of someone's concerns because you don't know where these concerns are rooted in. Maybe they know someone, maybe they heard something. Don't be dismissive of that, but you can back it up with the data, with the facts, and support what it is that you do. Another thing is, and we've addressed this earlier, was just navigating the various levels of support that you will receive, because you will have clinicians that are going to enthusiastically endorse you. You're going to have people that are skeptical, and you're just going to have to balance the two. And so try your best to tailor the communication approach to each person's perspective. Sometimes, if you're dealing with a skeptic, you may want to add additional research or be sure to support what you're saying with things like the ASCO guidelines. ASCO guidelines were published in May of 22, basically saying any patient that's being treated with a curative intent needs to be referred to an exercise program. That's a huge statement by colleagues of these skeptics sometimes, that it's the medical community that is saying that patients need this, and being prepared to cite that, being prepared to talk about the NAPBC standards, which now include exercise for breast cancer patients. We do have the support of many medical professional organizations, and know that, keep that in mind, and respectfully, when you're talking to a skeptic, if there is an opportunity to share some of this data, I think it's important to be able and to be prepared to be able to do that. Another thing to keep in mind is we're going to be communicating with people in a very busy setting. That's one of the things that I hear probably the most when I'm talking to physicians is I'm in a room with a patient, I have 10 minutes and I have to address treatment, I have to address wounds, I have to address radiation burns, whatever, all of the things, and exercise. And it's a lot for them to have to address. And so the easier, the more concise you can make it for them to talk about exercise to their patient, to refer patients into the program, the better it's going to be. And then when you're talking to them, be respectful of their time. Be respectful of the fact that they probably have an entire book of appointments that day, and they're giving you their time, they're giving you their attention. Be a good steward of that. Make sure that your communication is going to be concise, focus on the essential things, convey professionalism, convey expertise, and just make sure that you're not going to waste their time with anything. And then finally, I think it's really important that we explain the benefits of exercise without overpromising. And so this is still cancer. There's still going to be the bad side of cancer, even when with all the patient's best efforts, with all the physician's best efforts, even then, sometimes cancer still has the last word. And so we want to balance our optimism and our faith in our programs that we can provide, and knowing that, hey, this is going to have a positive impact in these patients' lives. Even in the terminal ones, when my grandfather was dying from cancer, he still saw benefits from exercise. So I do know that. But we can't say things like, oh, if you exercise, it'll cure you of your cancer, or making these broad promises, because all that's going to do is just decrease your credibility. It's going to decrease their trust in you. It'll decrease the patient referrals into your program. So you really want to make sure that you're supporting everything that you say with research. You're balancing optimism with the reality of what cancer is, and you're being mindful of the words that you use. I find it's always very helpful to stick to data. And if there's a meta-analysis that shows a risk reduction of cancer recurrence or cancer mortalities, have those statistics ready to share. But you can't overgeneralize to the whole population. You want to use words like risk reduction, not no one will ever have a recurrence. You want to kind of balance that out in terms of, excuse me, patient communication consideration. So when you're a top cancer patient, it's going to require some specialized communication. So to begin with, I think it's very important that you recognize the emotional vulnerability of the patients. So remember that these patients are going through a traumatic experience. Maybe they didn't see this diagnosis coming. Maybe this is something they never thought would happen to them. They're likely experiencing grief, fear, uncertainty. Just imagine the feelings that they must be having, and adjust your communications style so that you acknowledge their emotional state while still helping them promote that self-efficacy, promote that empowerment that physical activity will bring. Meet them where they are, but don't leave them there. Don't be afraid to give them hope and to inspire them to make a lifestyle change. Again, balancing that optimism with a sound research base and data to support what it is that you're saying. But don't be afraid to offer them some hope while meeting them there where they are and being empathetic to their situation. Also, adapting to cognitive changes. I don't think this is something that is talked about enough, and I think it really should be. So, understand that sometimes treatments like chemotherapy may impact an individual's attention span, their memory, their processing speed. We call this chemo brain. It is a reality for a lot of patients who are undergoing chemotherapy. It's not just something you hear about that isn't real. It is real and it can be devastating for some of these patients. And so find ways to work with these individuals who are experiencing these cognitive changes. So, some things that you can do are provide written instructions to help supplement what it is that you're teaching them during the exercise session. You can also break information down into smaller, more manageable chunks, and then check for understanding frequently while you're working with them, just to make sure that they're following, they understand what you're doing, what you're saying, making sure you're being aware of that. Another thing is addressing exercise fears. So many patients worry that activity could worsen their symptoms. My son is downstairs sneezing so loud. I don't know if you heard that or not. Okay, sorry. Back to what I was saying. Many patients have exercise fears. So sometimes they worry that physical activity could worsen their symptoms. So this is especially true with regard to fatigue. So if you think of patients, so many of them experience fatigue. And when they think of exercise, they think, how in the world can I do exercise when I feel this exhausted? How in the world am I supposed to do this? And sometimes you're going to have to address these concerns, again, meeting the people where they are and validate that these fears are common and that it's understandable that you would feel that way. When someone is experiencing the fatigue, it does make sense that they would want to rest. It does make sense that they would want to lay on a couch and do nothing. That is what most people want to do when they experience fatigue. And so validating that and then share with them. There is research that shows that light to moderate exercise can actually boost your energy levels. And let's try 5 minutes. And if after 5 minutes you feel like it's just too much, you can't really continue, well, then we'll stop. But if we can do 5 minutes and you're feeling okay, then, maybe we can try a little bit more, but let's just see how you're feeling. Doing something like that where it's small and it's manageable and they know they have a way out if they need one will be very important, and that will, encourage them to try something that maybe they wouldn't have tried otherwise. So respecting their fears, but not being afraid to address them and give them an option to try something new. I always share the story about my grandfather where he had stopped eating. He was so exhausted that he couldn't even eat scrambled eggs that my grandmother was feeding him. And so when I came and said, let's take a walk around the downstairs of your house, I know my family thought I was crazy because they're looking at him and they're saying he's too tired to be fed scrambled eggs. But he did it. He got up out of bed. He did a lap around his house, which is a very small house. He went back into bed, and that made such a difference in his recovery. He started eating again. I believe it's what gave him the energy and the strength to say goodbye to us as he was dying. He stayed in his home. It was something that he looked forward to. We would be talking, and the timer that I set for his exercise program would go off, and he'd get like a little twinkle in his eye, and he'd say, "Oh, it's time for my exercise." His world was spinning completely out of control at this point. He had no control over anything that was happening, but this was something he could control. And so even in his final days, it made a difference. And so I share that story just because sometimes if people don't live in this exercise world, they hear exercise and they think, I can't run. And we're not going to ask you to run if you're experiencing that level of fatigue. Can you walk around the downstairs of your house? Let's try that. Let's see how that is. If that's all you can do, we'll set a timer and we'll try again in an hour. giving them small, manageable things to do and addressing their fears, I think is going to be really important. The next thing that you want to do is communicate with patients and through their fatigue. So that kind of goes along with what I was saying before. But I think developing language that kind of distinguishes between a high intensity exercise and something that's low to moderate intensity, like walking. I think teaching patients to recognize when they need to stop an exercise session if it is too much for them. Usually, I'll say things like, you should be able to talk through this workout. And so, if you reach the point where you're not able to talk, if you're finding that you can't catch your breath, we're going to back that off. That's going to be too high of an exercise intensity. And that's something simple. You don't want to be like, find your pulse and let's sit here for 15 seconds and count how often your heart beats. That's probably not going to be realistic when you're working with a cancer population. So giving them things that they can recognize. Can I talk? Am I finding it hard to catch my breath? Those are things that we can all recognize when they're happening. And then we can recognize them as stopping points in the exercise program. Another thing I think is really important to be aware of is respecting body image concerns. And we run into this a lot with our patients. So I think traditionally people hold to the view that if they get cancer, a lot of times people will have the image of someone who's cachexic and has lost a significant amount of their body weight and their muscle wasting and all of those things. And that is true for some types of cancers. Some patients do experience that. But then on the other hand, you have some patients who may have a hormone-driven breast cancer, or maybe they're on androgen deprivation therapy for prostate cancer. And those individuals experience the opposite. They experience significant amounts of weight gain in a very short period of time. And so it is not uncommon for us to have breast cancer patients who potentially had a mastectomy, that they're dealing with that. And then as they're going through their treatment, sometimes they gain 30, 40 pounds in the 16 weeks that they're in chemotherapy. And acknowledging that and what that would do to the body image and the way a woman would see herself. She's had this figure altering surgery. She's gained 30 pounds. She's lost her hair. So many things that can be very difficult to come to grips with as an individual. I think it's very important to be aware that someone could be having those struggles. And so, as an exercise trainer, I think it's really important that you create an environment that is going to minimize their self consciousness while encouraging appreciation for their body and what they can do. So, focus on function, focus on the achievements that they're able to make in this exercise program. Maybe minimize the number of mirrors so that you want to kind of balance that, because you want them to have good form, you want them to know what good form looks like. But if they're really struggling with body image and with their self-confidence, maybe you try to find a place where they're not exercising initially in front of a mirror. That could potentially help them. And just I think it's just important that you be aware that a lot of patients are really struggling with that. Another thing I think is important is to acknowledge the pain and the discomfort that patients are likely experiencing. So validate their symptom experiences while helping them to distinguish between what is a potential treatment complication, what could be because exercise exertion is too hard, helping them to distinguish between the two. And I think if the more you work with this patient, you can develop a shared vocabulary that will help you to differentiate between, is medical intervention needed at this point, or is this exercise session not working? We need to bring it back a little bit. So just being aware of those things. And then finally, I think it's so important to use motivation strategies with your patients. Don't be afraid to set goals with them. At the beginning of this year, I did a 4-week goal setting seminar with our patients, and it was Wednesday nights. I would do a Zoom call just like this, and I took through a goal setting framework that I do myself every year. And I had a patient say to me, she said, I was afraid to dream again after my cancer diagnosis. And she was like, I'm so glad that you talked to me about setting goals, because it has just renewed my perspective on life and on the fact that I think that I can beat this and that it is going to be okay. And made them think about something beyond the diagnosis that they're facing. And so don't be afraid to help them set goals and things that are going to be meaningful for them. Maybe hey, there's a 5K and maybe we can walk it together. Something like that, where you can do that with them. We've had patients that have done this before with their trainers, and it's just like such a meaningful accomplishment to them, especially if they've never exercised before and then they get cancer, and then they can walk a 5K or even jog a 5K. And that's probably something they never thought they could do. And it can be such an empowering thing. So set goals. Don't be afraid to try different motivation strategies for that. Okay. Next, let's talk about the impact of effective communication on patient adherence and outcomes. And so there is research that demonstrates that communication quality has a direct influence on things like the initial program uptake and adherence. So, the way that exercise introduced to a patient is significantly going to impact their participation. When patients receive clear explanations of the exercise benefits, they have a 30 to 40% higher program completion rates than those who receive generic information. So, instead of saying things like, "Hey, you should exercise, it might help you feel better." That would be like a generic thing. That's probably gonna have a pretty low participation rate. But if you say things like, "Hey, exercise programs have been shown to reduce fatigue by 40%," or, "Hey, we'll schedule your exercise sessions to align with your chemotherapy so that you'll have more energy." Saying things like that, understanding, like showing them that you understand their journey, where they're coming from, they're going to be far more likely to adhere to your program. So, making sure that you're clear with that patient and you address things that are going to be meaningful to them. Patient self efficacy is very important. So, you really want to do your best. You probably are going to have a limited time with your patient. Most of the time, we have our patients for 12 weeks. And in that 12 weeks, we want to develop their self efficacy so that they continue to exercise on their own. Patients who exercise when they're completed with active cancer treatment are more likely to stay in remission and are less likely to have recurrences and cancer related mortality and all cause mortality. And it helps them to manage other chronic disease symptoms as well. So there's a lot of benefits to getting your patients to feel that they can exercise, to help them have that belief that they can carry on and execute an exercise program. And so you want to build that self efficacy in that time that you have with them. You want to have clear communication that's going to build their confidence in their exercise capabilities and then lead them towards greater independence with this activity. So, studies do show that patients whose exercise oncology instructors use confidence building language have maintained higher levels of activity between the supervised sessions that they have. So keep that in mind. Another thing you want to teach your patients about is accurate symptom reporting. So encourage patients to have an honest disclosure of symptoms that could negatively impact the exercise response. We have had patients who didn't say that maybe a weight that they were lifting was too heavy and then later have swelling in their arm. That has happened before with Maple Tree. We want our patients to feel comfortable reporting their symptoms. Patients who feel comfortable reporting their symptoms are 65% more likely to receive appropriate exercise modification. And when that happens, then they're less likely to ditch physical activity. So you want to make sure that you are letting them explain their symptoms that they're having and then help them troubleshoot those symptoms. Integration with treatment schedules is very important because understand that when someone is in active cancer treatment, they probably have a very full schedule of doctor's appointments, of treatments, of maybe they're in physical therapy, maybe they're trying to work, maybe they're trying to manage a family while they're going through all of this. And so you want to make sure that you have a coordinated communication between the medical team and the exercise team to optimize the timing of their activity. The exercise should be scheduled in consideration of treatment side effects in addition to the other appointments that they have. And that will just help build adherence around the exercise program. Next, exercise that is properly communicated as a strategy to manage side effects is going to improve their treatment tolerance and treatment completion rates. So recently at Maple Tree, we published a study that looked at chemotherapy dose delays and dose reductions in patients with advanced tumors. We looked at 27 different tumor types and they all had different chemotherapy regimens. But essentially, we found a 15 to 20% reductions in dose modifications in the patients who exercised compared to the patients who didn't. And we believe that it was because exercise helped to mitigate those patients' side effects. And so, exercise is a great way to help improve treatment tolerance and reduce the severity of the patient's side effects as they're going through treatment. And then finally, psychological well being is so important. It's going to require communication that frames exercise as helping that patient to regain control during their cancer treatment and using that to support their emotional health. Patients do report significantly improved mental outlook when exercise is effectively presented as a self management study. So again, when it comes to cancer, so many things happen outside of our control. We can't control that we got cancer. We can't control the treatment. We can't control how our bodies are going to respond to that treatment. But this is something that we can control. And when you're dealing with anxiety, when you're dealing with depression, when you're dealing with all these emotions that are very common in a cancer diagnosis, focusing on that, on I can control this, and how does it make me feel when I'm done, and how proud I am of myself for doing these exercises and for my body for being able to be strong while it's fighting something so hard. Those are all going to help improve the psychological well being. And so don't be afraid to address that. I think sometimes as exercise physiologists, we're not super touchy feely. Like we are pretty much get in, lift the weights, let's go, hardcore. And I think there's a time and a place for that. That's definitely more my personality as well. But there is a time and a place to focus on the psychological well being and how this can improve your mental health, how you can lessen your anxiety and the fears that you have with these positive changes. So don't be afraid to go there with a patient because it truly does impact their life in such a positive way, far beyond just physiologically. So now that we have examined the importance of proper communication with patients, let's take a look at communicating with the clinical team. So to start, let's take some steps to look at medical terminology and oncology specific language. These include things like cancer classification terminology. And so, as an exercise professional, I think it's very important if you're working in a clinical setting to have an understanding of the various staging systems that are used for tumor staging, such as the TNM, tumor staging symptoms. You should understand tumor grading. You should understand different exercise contraindications that may be present for specific cancer presentations. We're not expected to be oncologists and to have that level of understanding of cancer, but I think it is important that you do have a foundational understanding of the language that physicians are going to use so that when you're faced with it, you understand what they're talking about and you look competent in these conversations that you're having. With regards to treatment modality language, I think you should take steps to understand and to learn at least a little bit about the various chemotherapy agents and any exercise relevant side effects that can be present with those chemotherapy agents. Which chemotherapy agents are linked to cardiotoxicity? Which chemotherapy agents are linked to balance deficits or chemotherapy-induced peripheral neuropathy? Having that baseline understanding of that so that when you get a patient who's on one of these chemotherapy regimens, even if they're not experiencing that side effect yet, you can at least troubleshoot that this could be coming down the road. And if you know someone is on chemotherapy that could potentially lead to balance abnormalities, build neuromuscular work into the exercise program. Maybe you can prevent the onset of balance abnormalities. Maybe you can delay the course of the balance abnormalities that are happening. Target the exercise program to the treatment that they're on. And in order to do that, you have to understand a little bit about the treatments. In terms of symptom assessment scales, these include things like ECOG scores. You would hear a lot of ECOG scores if you work in a clinical setting. So familiarize yourself with what ECOG performance statuses are, what pain scales are that are used by oncology teams to evaluate patients. This will help you have a better understanding of the health status of your patient so that you can safely and effectively individualize that exercise program to them. And then finally, we come across some oncology abbreviations from time to time. So understanding what 5FU is, understanding what PIC is, like these are oftentimes used in medical records. And so have a knowledge and an understanding of some of these oncology abbreviations so that you can follow what's being talked about in some of these clinical discussions and participate a little bit more effectively in the conversations. So next, let's look at translating exercise science concepts for medical professionals. And so when you're talking to the medical care team, you want to try to follow some of this framework here while you're talking to them with regard to the exercise program. So connect the exercise program to medical outcomes. So translate things like moderate intensity exercise training. That is a very exercise science term into something that's going to have a little bit more medical relevance. So cardiorespiratory conditioning to reduce cardiotoxicity risk. That would be pretty much the same thing, but saying it more in their language. Using biomedical frameworks, you can describe resistance training as an intervention to help maintain muscle protein synthesis. Again, that's going to be a concept that's going to matter to a medical team, and showing them that, hey, we have an understanding of this and resistance training will help with this problem that patients may be having. You want to quantify the exercise dose. So presenting exercise in dosages with specific guidelines around the frequency, the intensity, the time, the type parameters. You want to try to give that information. Oftentimes when I'm talking to a new hospital, I'll get those kinds of questions. How often does the patient meet with you? What does the exercise intensity look like? How long does the average session look like? So being able to speak to those in general terms, I think is going to be really important. Being able to reference medical guidelines. We did talk about that earlier in this presentation, but being able to, on command, cite recommendations from ASCO, from ACSM, from the NCCN, rather than just an exercise science authority or, hey, I was watching this webinar with Karen Wonders and she said patients should exercise. Being able to support what we know to be true with the medical guidelines and these national organizations and what they're saying is going to be very important. And then also, and I don't think this is talked about enough, is apply evidence hierarchies. What that means, when we're sharing evidence and data and research to the clinical team, understand that not all research is the same. And if you use data from a meta-analysis, from a randomized controlled trial, that is going to hold more weight than something like, "Oh, I read this in Muscle and Fitness magazine." You want to understand that not all research is the same. And the ones that do have the highest credence are the randomized controlled trials, are the meta analyses. Observational studies are great. And if that's all that you have, definitely you can use that, because if it's in a peer-reviewed journal, then, that's fine. But understand that the more you lean towards the RCTs, the more you lean towards the meta-analyses, the more weight your translation of the exercise science concepts will hold. So just keep that in mind, that not all research is created equal. I would also get to know some of the higher esteemed publishers in this field and be ready to cite their work, because there are people that are going to be more recognized. So Katie Schmitz is one of those researchers that so many people are familiar with her work. And so if you cite something that she has written, that's going to automatically validate what it is that you're sharing. So keep that in mind as well. When it comes to documentation and best practices, and basically this refers to the data that you're keeping on your patients with regard to the exercise program. And so as you're doing this, it's rare that a doctor will want to come and see your notes with regard to a patient. Generally, you're going to share back progress reports or like aggregate data, but it's still, I think, is really important to get into the habit of using the type of formats that are used in a clinical setting. So when you're doing medical records, then, structure your notes using the SOAP format, which is subjective, objective, assessment, and plan for easy review, because that's what the rest of the clinical team is going to be using. And you want to position yourself as part of this clinical team. You want to lead with significant findings. So begin with the critical information and any red flags rather than like chronological reporting. So remember that the medical team is under some time constraints. So you want to be aware of that. And you don't want to be like, Sally came in and we were walking on the treadmill. Just stick to the things that are important, any red flags that you see, and omit everything else. You want to include validated measures. So incorporate some recognized assessments like the 6-minute mile test or the FACT-G, which is a recognized quality of life measure. Using those to validate the things that you're reporting are going to just add more validity to the data that you're keeping. And then aligning with treatment phases. And so this is something that we do at Mapletree. We organize our documentation around treatment concerns. So if there's fatigue during chemotherapy, if there's lymphedema during radiation, at Mapletree in particular, our exercise oncology instructors are taught how to prescribe exercise according to the various phases of cancer treatment. So if someone is in the prehab phase, that exercise prescription is going to look different than someone who's in chemotherapy. And so making sure that you're aligning your exercise prescription with where that person is in their treatment is going to be very important. And then finally, with regards to case reporting and progress updates, you really want to find a rhythm of reporting patient progress and updates with your physicians in the clinical teams that you're working with, and find what's going to work for them. So you might have some physicians that like frequent updates. So maybe monthly, maybe biweekly reports, and then others are going to want less frequent communication. So find what is going to work for them and then tailor your reporting accordingly. But that doesn't mean don't report and don't record data. Always have that data ready to go, because you never know when the team is going to come back and say, okay, how many appointments did you have? How many people completed? What were their outcomes? You always want to be ready to report that data if they come to you, but be sensitive of how often does this physician want to hear from me? And if you feel like it's too much, ask them, do you want these reports monthly? Do you want these reports quarterly? What is going to work best for you? And maintain the data anyway and be ready to go when needed. So some of the ways that you can do that are with treatment-centric framing. So highlight how exercise is going to support the treatment. So you can say something like patients maintained fitness for the full dose chemotherapy without any delays. You can report in function with regards to function. So emphasize that things like, hey, this patient can independently transfer, and enabling discharge readiness. That's something that's going to make a difference with them. In terms of symptom management, you can document the impact of treatment limiting symptoms. So saying something like neuropathy was reduced from a 7 on a scale of 1 to 10 to a 4 on a scale of 1 to 10 following proprioceptive training. That is really important data to share right there. Risk stratification language is communicating in clinical terms such as increased dyspnea at low workloads, which suggests potential pulmonary compromise. So that's something we're going to evaluate. That's going to be meaningful to the clinical team. And then again, using concise delivery methods. So using succinct email updates with verbal reports and one-page summaries, respecting the physician's time. With regard to navigating hierarchies and professional boundaries within the medical settings, you want to be aware to respect your scope limitations, clearly delineate where exercise advice ends and where medical guidance begins, and stay in your lane always. Follow communications change, so learn who to approach with different concerns, when to use nurse navigators versus direct physician communications. You really want to try to navigate that well. And then master meeting etiquette, knowing when to speak and how to present concise, relevant information is going to be very important, particularly as you're invited to participate in tumor boards or cancer care conferences or whatever that might be. Presenting your data concisely and supporting what you have with research is going to be very important. We do highlights from these webinars as well as tips and tricks, and you can hear directly from our trainers at Mapletree some behind the scenes tips on working with patients and why they got into the field, why it's meaningful to them. So I would invite you to check all of those out. If you have any topic ideas for the fall, please feel free to share those with us. I have an outline of ideas that I wanted to tackle, but if there's something that didn't think of and you're like, "Hey, I really have this question," I would love to address that in a future webinar.